Good afternoon, everyone. Thank you for joining us for our daily press conference. We will begin today by calling up our Mayor, Mayor Boduro, for some comments. Mr. Mayor.
Thank you, Chief. I want to first start by expressing our appreciation to Sherwood Baptist Church. It's my understanding that Sherwood has allowed us to convert some billboards that they have rented in town to encourage citizens to shelter in place. Likewise, Fairway Advertising will be allowing the city to use a video billboard to make what's essentially a public service announcement. We all are going through this ordeal together. And I want to say, Dr. Kitchen's here. My oldest son turned 30 last night, and we celebrate. He was going to where he went to college, and he's going to have a birthday party, spend the weekend with some of his friends that was from college that was canceled. We played Scrabble. I'm sure that was not his idea of a 30th birthday party, but we are working through this together, and I want to make just some comments, practical advice to our stores and residents. We have to combat this thing together. We are getting some reports. Most of our businesses are in compliance, and I know that there's nothing insidious about this, but convenience stores particularly, we have to minimize the number of people who are inside the stores. We have in our executive order to restrict the number of people to the 50% capacity. And these practical instructions, please, businesses, consistently throughout the day, disinfect shopping carts. These are being utilized by people throughout the day. Disinfect keyboards. This is for the protection of your own employees. Clean objects like doorknobs, and if at all possible, make hand sanitizer available in and around the entrances. Particular precaution needs to be taken in businesses such as grocery stores, building supply stores, where customers routinely touch merchandise. There's one thing, and I hope Dr. Kitchen will speak to it, that's been brought to my attention. Another precaution that we as citizens can be taking is wearing a mask when we're out in public. And I am not particularly conversant with this, but this N95 mask is a respiratory mask that we keep hearing about. That is for the protection of the individual, usually the healthcare providers. But if we, when we go out in the public, if we could just use a regular paper mask, I think that would be a precaution that would be helpful. And what I understand, and Dr. Black got up here yesterday and said, remember, one thing that is particularly frightening about this virus is that 80% of the people, in Dr. Black's words, have little or no symptoms. So there are people walking around in the community who have the virus and have no idea they have the virus. What is terrifying about that is you can transmit the virus. And that is one reason why it would be helpful, and we encourage everyone. Dr. Ruiz is here, and I'd like them to speak to it about when you go out in public, please take the precaution of wearing a paper mask to protect other people. And again, businesses, please, throughout the day, desanitize doorknobs, keyboards, and shopping carts. Thank you.
Thank you, Mr. Mayor. I'd like to bring up now the chairman of the Dougherty County Commission, Mr. Christopher Cohilas, for some comments.
Thank you, Chief. Thank you, Mayor. We are currently evaluating a lot of different things for our community. First, I want to thank all of the citizens for working very hard with us in order to be in compliance with the order that we have in place, which is in place not only for our safety, but for the safety of our neighbors. I also recognize that there are some folks that have not followed the rules, and we certainly encourage you to please contact the Daugherty County Emergency Management Agency at 229-302-1900, 229-302-1900 to make reports of those instances. Secondarily, I want to assure you that we are evaluating what is and what is not an essential business. And we recognize that there have been some businesses that have operated in the gray area of the ordinance that was passed. We literally have a team that is evaluating that and also taking in calls and answering questions. If you have a question about what you can or cannot do with your business, please, again, call the Emergency Operations Center at 229-302-1900, and we'll make sure that we can get you an answer. Even if it's not the same day, we'll try and get that answer to you within 24 hours. I've had many different calls about whether or not a business can carry on certain functions, if it's in a drive-through capacity, or if it meets the definition of an essential business. Additionally, there are certain reports that have come to us about some businesses that literally do not meet the definition of what is an essential business. I think you will see those businesses going offline, and that's not to mean that anybody did anything wrong, but we need to provide clarity to our community so that businesses can operate. The ones that can operate clearly and understanding that they're following the rules, and those that cannot operate are taken offline so that we can reduce the overall number of interactions that we have within our community. I also want to mirror what Mayor Duro said regarding our corporate partners, and I want to say this. One of the things I'm going to be asking our team to do over the next few weeks, in which we've already been getting a lot of reports regarding, is what has been the overall level of compliance in our major supermarkets. Because I've heard a lot of reports, and I've even seen where some supermarkets are doing the right thing and some supermarkets are not doing the right thing. Our supermarkets need to be making sanitizing wipes available to everyone. They need to be encouraging social distancing amongst all of their customers. They need to actively be evaluating whether or not they are at 50% occupancy or not. These aren't suggestions. These are requirements that have been put in place so that we can go ahead and begin to flatten the curve, and we're not there yet. And these are the types of measures that have to be in place in order for us to flatten the curve. Thank you.
Thank you, Mr. Chairman. Next, we'd like to have a report from Phoebe. Dr. Stephen Kitchen is here. He is the Chief Medical Officer of Phoebe Putney Memorial Hospital. Dr. Kitchen.
Thanks, Chief. And I will tell you, at the admonition of some family and friends, I'm going to try to practice what we preach. And so I've been told I put my hands on the podium when I come up here, so I'm going to try to start by doing my part and wiping this down, because, you know, the little things truly do matter. I'm going to begin, I think Mayor Dura posed a great question that I'm going to try to respond to regarding the use of masks. And I will tell you this, you know we have many effective basic infection control measures that we can all take. You know, I think probably, you know, social distancing and truly practicing that in the current environment we're in is probably one of the single most effective steps that we can take. Practicing hand hygiene, unquestionably the oldest, but also the most effective step that we can take. And because we know this virus does have a propensity for living on surfaces, as you've heard, really trying to be vigilant about cleaning and disinfection, wiping down surfaces, keyboards, all those sort of things will equally be quite effective. Regarding masks, And I will tell you, I think it's one of many prudent steps that can be taken at this time. So I think there's a lot that you hear about the different type of masks. Just very briefly, I will try to speak to that. There's what's called an N95 respirator. That is a specific type of mask that is really intended for healthcare personnel. It's got a really pretty sophisticated filtration system that's involved that really filters out those particulate particles. We know that COVID-19 is a virus that spread predominantly by respiratory droplets. So an N95 respirator, over 99% of those particles are filtered with the use of an N95 mask. So we equip all of our frontline staff who is on any of the units that have patients that are either positive for COVID-19 or have tests that are pending for COVID-19. We equip them with an N95 respirator mask, and that also applies in our emergency rooms as well. A simple surgical mask can be very effective if you are concerned that you are at risk for transmitting this to other people. The simple application of a surgical mask can be very effective. It's one of many tools that can be used. So, case in point, every patient who comes into our emergency room, we ask them to put on a simple surgical mask. I think it's a case we're trying to all be responsible and prudent in terms of how we use supplies, PPE, that sort of thing. And so I think social distancing plays a huge part. But I will tell you, if you have the availability of using a surgical mask, it can also be a very effective and prudent step that can be taken in flattening the curve and reducing the transmission of this virus in our community. I'm going to kind of briefly review what our latest statistics are at Phoebe Putney Memorial Hospital and across our health system at large. So currently, and I will say this, we had a lot of test results that returned yesterday. We had a little over 250 test results that returned. And again, there's a little bit of positive news here. We had 91 positive tests that returned, but we also had 159 negative tests that returned because, until recently, the number of positive and negative tests were really about equal. If anything, we had more positive tests than negative tests. But to date, we have had a total of 357 patients who have tested positive for COVID-19, and we actually have had 533 people or patients who have tested negative for COVID-19. So I think we're at least beginning to get some indication at this point that we have more people who are testing negative than are testing positive. And I think that's probably a function of the fact that we have greater test availability now than certainly we did a week or 2 weeks ago. And I will tell you, we're very optimistic that we're going to have the capability to do in-house testing at Phoebe Putney next week. The software for the laboratory module that we use is scheduled to arrive on Monday, and the reagents are scheduled to arrive on Tuesday. There will be some testing and what we call quality assurance that has to occur before we bring those tests online, but I think it certainly is a realistic expectation that we may be in the position to offer in-house testing effective next week. So again, to review our numbers, we have a total of 357 patients who have tested positive for COVID-19. 53 of those remain in the hospital. We've had 2 additional deaths. We've gone from 16 to 18. I know there was a patient on one of our inpatient units who unfortunately experienced a cardiopulmonary arrest. Full resuscitation measures were taken. The patient initially was able to be successfully resuscitated, but unfortunately succumbed to COVID-19, and we had an additional patient in our intensive care unit who expired as well. There continues to be a lot of calls into our 24/7 hotline. There's almost 6,000 calls that have been fielded over the last 2 weeks, so I think that gives you some indication of the level of, I think, the recognition in our community, and we're very pleased that we have been able to offer that. And there have been over 1,000 people who have been screened and tested through our drive-through screening process. So currently, there are 46 patients who remain hospitalized. Excuse me, let me back up just a minute. What I will tell you is at Phoebe Putney Memorial in Albany, we currently have a total of 119 patients in our facility who have either tested positive or what we refer to as a PUI, a patient under investigation, simply meaning that their test results are still pending at this point. So we have 46 patients at Phoebe Putney in Albany who are in-house in our facility who have tested positive, and 73 patients who have a test who is pending at this point. All of our 3 ICUs that we house our COVID-19 patients remain at full capacity at this point, and we have a total of 8 beds on our general medical units that are available for COVID-19 patients who come in our facility who do not require an ICU bed, and we continue to see a lot of patients coming into our emergency room who do fit that category of what we call a person under investigation. Again, I want to take this moment to commend and to profusely thank our sister hospitals across the region and really across the state who have been, I think, more than understanding and cooperative in terms of acknowledging the problem with limited capacity that we have here, because like we have stated before, our intensive care units have operated at full capacity for well over a week, and we simply have not had any additional capacity for COVID-19 to admit further COVID-19 patients into our intensive care unit. So I particularly want to mention Tiff Memorial in Tifton has accepted many of our patients, including critically ill COVID-19 patients who need an ICU bed. And I will tell you, South Georgia Medical Center in Valdosta has been equally cooperative and a great partner as well. Our 2 sister hospitals in Macon, Navicent Medical Center and Coliseum have also been very, very cooperative and have accepted multiple patients as well. Chris Memorial in Cordele, several of the Columbus hospitals, both Piedmont and St. Francis as well, have received several of our patients. We have reached out as far as Atlanta and Augusta, and again have had an overwhelmingly positive response from those facilities as well. But I think this underscores the fact that we're not going to solve the current demand by looking externally at this point, because those facilities are accepting our patients because they do have capacity, but they also understand we don't know where we are in that curve, and that they don't know where they'll be a week or so from now. So I will tell you, I think we are doing everything within our power to expand capacity at this point. And yes, finding the physical space and the equipment and supplies is one aspect of that, but finding the qualified staff, additional physicians, nurses, respiratory therapists, that is really the daunting challenge that is in front of us at this point. And I will tell you, we are exhausting every possible resource that is at our disposal at this point. So Governor Kemp, as you are probably aware, has activated the National Guard. So 2 medical corps that are attached to the National Guard started appearing at our facility yesterday. And I will tell you, I mean, it really is a heartwarming response. These people have an overwhelming sense of duty and service in terms of being, fully willing to put themselves in harm's way. So we have physicians, nurses, emergency technicians who have arrived. And so that's one step of the process. We are very encouraged by some of the, I think, very definitive actions that Governor Kemp has taken. So the state is working with us right now to, I think, significantly increase capacity. And I think although we need more general medical beds, and the staff, the nurses to properly staff those beds is important, it's really the availability of additional ICU beds is really, I think, what is in critical shortage at this point. So I can tell you, just before I came, I was reviewing what we call critical care physician candidates who may be coming into our facility as early as next week. And, this is just a very, very encouraging sign for us, because, I think we never want to be in the position where we feel like we don't have the bed or we don't have a staff, and we're looking to transfer patients elsewhere. And although we're so appreciative of the cooperation we have received from sister hospitals, it is absolutely part of our mission and our responsibility to serve the needs of this community. So we're hopeful we can expand our ICU capacity from the 38 beds that I have mentioned. And I also want to mention we've added 10 additional beds, ICU beds for non-COVID patients as well. But we're hopeful that we may be able to be in a position to expand our ICU capacity by somewhere between another 10 and 22 beds at this point. So, we're looking at taking our ICU capacity from 38 somewhere up to 60 to 70 beds. And, I think that's huge, because what we're seeing, unfortunately, is some of the patients that we admit to our general medical units will tend to, their respiratory state can become compromised in a relatively short period of time, where they really need an ICU bed, and then we're trying to put everything we can to meet patient care needs when we don't actually physically have an ICU bed to move those patients into. So I can tell you we are just basically working around the clock at this point to try to make sure we have everything in place where we can meet the needs for that extra capacity at this point. Another thing, and I think certainly our state and federal officials are fully aware of the critical shortage of equipment and supplies. And I simply cannot say enough about the Herculean efforts that our Chief Financial Officer, our VP of Supply Chain, and all the people that work with them. I mean, they have exhausted every avenue, not just within the continental United States, but across the world in trying to procure the equipment and supplies that we need, because our most fundamental responsibility is providing safe care for patients, but just as importantly, to keep our workforce safe. And that's just a commitment that we will never back down from. So the question about, do we have enough ventilators comes up. And again, we had 20 additional ventilators that arrived earlier this week. The National Guard brought an additional 5 with them yesterday. And again, staying in close communication with the governor and his task force, we're doing everything that we can to make sure we're never in a position where we don't feel like we have enough ventilators for our facility. But at the same time, I think we have to acknowledge that this is a national concern at this point. And I've spoken about this a little bit before, but what we're really looking at is not only flattening the curve in terms of the transmission of this virus, but also looking at novel treatments and therapies that can alter the percentage of people who become infected, who become seriously ill and need an ICU bed. So I just want to briefly mention we have a physician cabinet. It's a small group of very, very well-respected and committed physicians who are collaborating with their peers to make sure we're looking at any potential therapy that holds promise at this point to alter what can be a very, very sobering course of this disease. I just want to take a moment to express my profound appreciation, both personally and on the part of our health system and organization, for the tremendous outpouring of community support. I think if you ever needed a very outward and visible sign that our community will rally in times of crisis, put what may be petty differences aside, and ascribe to a higher purpose in the greater good. That is what I have seen manifested over the last week. So, from food and cookies to supplies to simple words of encouragement and support and prayers. I will tell you personally, those thoughts, the expressions of support, encouragement, and the prayers have truly sustained me over the last week or so. I think we acknowledge this is not going to be a sprint. It's going to be a marathon, but we're going to get through it together. I think we've all known that we have a very resilient community. I think we all know the incredible hardships that we've had to endure the past several years as a community. But yet, the character of our community, I think, is demonstrated every time, where we pick ourselves up by our bootstraps. We rally together, we come to each other's aid, and we do what's necessary to move aside. But I also want to speak to the fact that both from the standpoint of Phoebe personally, but also as a community, our unwavering resolve to get through this, because we will prevail. But it's going to take everyone's efforts together, because we all have a responsibility. And I would just, again, like to close with a brief quote that's meant a lot to me. It's a quote that I shared with my daughters, and I think just one of many things that I draw strength from. And it's a quote from Helen Keller that says, "Character cannot be developed in ease and quiet. Only through experience of trial and suffering can the soul be strengthened, vision cleared, ambition inspired, and success achieved." Thank you.
Thank you, Dr. Kitchen, for your remarks. Next, I'd like to ask for an update from Public Health. I'd like to ask Dr. Charles Ruiz, who is the Director of the Southwest Public Health District, to come forward for some comments. Dr. Ruiz.
A lot of folks are aware that there are residents of long-term care facilities in our area who are dealing with illness at this time. There are facilities for long-term care where there are patients with COVID-19. And that's something we really did not want to see in our community. For one reason, most of the folks that live there would be considered vulnerable, either because of their age or because of an underlying medical condition. Another reason why that is so dreaded is because of the limitations of the facility itself. It's been said many times that one of our most important means of combating this problem is social distancing. And for many of us, we have a lot of options. Many of us live in homes that are large enough so that a sick individual can stay in one room by themselves, or during the day we can get out and spread out. I've seen some people walking through Tiff Park, and they're walking 20 or 30 feet apart from one another. But it's different in a long-term care facility, and whether it's influenza or COVID-19 or another respiratory tract illness, we are limited on how far we can spread people out. So in public health, we have reached out to long-term care facilities weeks ago to try to prepare them for what might be coming. We share literature and recommendations that they might put into practice. And if you really look at it, it's kind of limited. When a respiratory illness gets into these types of facilities, well, what you do to try to prevent it would include keeping the facility clean, hand washing, particularly for the staff who go from room to room. Personal protection equipment needs to be used in appropriate occasions and changed. So there are some things that you can do to prevent it. But once it gets in there, One strategy is to isolate the symptomatic individual as much as can be done in that facility. Another step that is considered, if the facility has a lot of individuals who are ill, is you can actually consider placing them together with the idea that they can't spread anything to each other, they already have it. So there are some strategies involved. Many of these strategies have been appropriately applied, yet we still have some ongoing sickness in some of our long-term care facilities. And I know that's very hard on the patients themselves and equally hard on their family and friends. It even adds to the difficulty when we consider that one of our strategies to control the infection involves limiting visitation. So it's just hard all around. We are pleased to announce that we are expecting a couple of staff members from the State Department of Public Health Office here this evening. These folks who are experienced and they specialize in the control of germs, and they're coming in from the state office to take a fresh look at the situation and perhaps provide some advice. We also recently had two folks from the CDC to come and work with us. They have returned to the CDC, but they remain part of the picture. They're working remotely with us. And I was pleased to hear Dr. Kitchen talk earlier about the National Guard, because we have a couple of units from the National Guard, at least one unit, I'm sorry, coming from the National Guard. They're here already. They have already looked at a couple of the long-term care facilities in the community. They may be looking at more. Not only are they studying the situation and providing advice, but they also are bringing human resources, clinicians as well. We hope to be consulting with them either this evening or tomorrow. We think that that's going to be a real boost for the services that are rendered in the prevailing conditions at long-term care facilities in our area. I want to say a word or two about social distancing, and one of the most touchy topics is funerals. Having funerals is always a difficult time. It's a heartbreak when we lose someone, and it's natural that we want to get together to comfort one another. We want to get together to honor the memory of the one that's been lost. And in this day and time, it is so unnatural to endure this type of heartache and have to stay physically apart from those who could provide comfort, from those who are experiencing the same loss. It's quite unnatural. And we understand why people are unhappy with complying with the recommendations that have been set forth. But we need to consider the dangers of congregating. And we want to ask that you consider ways that you can comfort one another from afar. We want you to consider ways that you can honor someone's memory from afar, perhaps through writing notes or sending cards to people who are grieving, or perhaps using social media to elevate the memory of someone that we've lost. I know it's also difficult on those who are funeral directors, because they want to please those who are grieving, and it's part of their nature to allow and facilitate services that will be pleasing and honorable. So we know that it's hard on them, but we ask that grieving families remember that even though you've suffered quite a loss and it's not going to heal overnight, if we don't practice social distancing, we're going to have more funerals. And if we work together and stick with this plan, we'll see light at the end of the tunnel, and we can resume our normal practices down the road. But please work with us. Keep the number of people down to 10 or below. Try to practice social distancing, even in the midst of despair. In the long term, we'll all be better off. I want to mention a word or two about masks. And while what I say might sound a little different from what the mayor might have said and Dr. Kitchen, I'm not saying anything that contradicts what they said, hopefully just to supplement it. One thing that I want to mention is if we're healthy and if we're wearing a mask, it very well may keep the germs out, just as Dr. Kitchen said. Just want to caution you, though, that if we're wearing a mask to protect ourselves, and if some of those droplets that Dr. Kitchen referred to actually wind up on the surface of the mask, we need to be careful about how we use that mask. If we're not careful, we can take the mask off with bare fingers, we can contaminate our fingers, and then those fingers, if they go to our eyes or our nose or mouth, we can actually infect ourselves. So we are planning to post a link on our webpage today that will take you to a video that will demonstrate safe and proper use of masks. That website is South Georgia Public Health, Southwest Georgia Public Health.org. And by this evening, we hope to have a link there that will take you to a good informational video. From time to time, quite frequently actually, I drive down the south side of Phoebe Putnam Memorial Hospital. I guess that's 2nd Avenue. But there in the middle of the block, there's the overhead crosswalk. And then down below, there's the crosswalk on the street. And most people, when they're driving down that way, if they see someone crossing across that part of the road, they'll stop and allow them to cross. And I do that too. Whether it's someone who's wearing street clothes and they look like a patient, or someone going to visit a patient, or whether they're wearing professional garb, and in that case I can identify them as someone who's either going to work or leaving. In either case though, when I see those professionals, I consider it a pleasure to slow down and stop and to allow them to cross. It's, for me, a tiny little way to honor what they're doing. And I think that if we open our eyes, we'll see what a blessing it is to have Phoebe Putnam Memorial Hospital in this community. Those people who are crossing across that way and going in and out of that hospital are sacrificing, they're working hard, they're committed, and those are true heroes in our community. Phoebe Putnam Memorial Hospital is the heartbeat of this community, and we should all be very grateful for what they're doing.
Thank you, Dr. Ruiz. I'd like to ask Dougherty County Coroner, Mr. Michael Fowler, to come up for some comments. Mr. Fowler.
Good evening. Out of all of that we do, we need to give thanks to God. We may not understand everything that's going on, but we still must give thanks to God. Out of all the 23 major disasters that I worked, I've been a part of, from the 94 to the 98 flood in Albany, to the World Trade Center and Ground Zero, to the tsunami, Katrina and Rita in New Orleans, from Maria, Irma in Puerto Rico to Haiti. This is one disaster that you really can't see or understand. Most disasters, you can know the flood water, you see the tornadoes, the trees down, the building destroyed. But this disaster, we can't see it. It's a hidden disaster. But we are seeing the result based on the number of people that's going to the hospital and the number of people that died. The residents in Dougherty County, that we've had so far, from the resident, from the nursing home, from Phoebe, from Emory, from Naviston, is 18 total death was positive from Dougherty County resident. And we have 10 more waiting the test results. We have a total of 28. Dougherty County residents that have been affected, homes have been affected. And on the list that we had yesterday, we have two came back, the test came back negative. That's one good thing. Our prayers go out and condolences to the families that have been touched by this storm. Before I came to this meeting, to this conference press release, I went to a funeral. They had about 8 people there, and I wanted to feel how does it feel to just only have a few of your family members there. I know in my family there's eight of us. If something happened to my parents, how would all of us feel? Who going to the funeral? So your grandkids can't go, your nephews and nieces, your neighbors, the co-workers can't go. It's the best thing to do now, like you said, social distancing. But I want to feel, how does it feel? It's very difficult for a family member saying they can't go to their grandmama or granddaddy funeral. And it's very touching. But one thing I thought about, I said, before I left that funeral, I got another call. I had to go back to the hospital again. Another person died. People are dying, just falling dead. And it's sad. Make it so bad, it's people that we know, co-workers, neighbors, individuals that we know. I mean, it's heartbreaking. Like I said, my prayers go out for each family that have been touched by this storm. One thing we can do, we can do that very easy. We can't go to see everyone, but you don't have to wait till someone die to give them their flowers. You ought to call someone on the phone and tell them you love them. If you don't ever make it to the funeral, call your family members and tell them that you love them, because this storm is not over. We have not reached the peak yet. We don't know how many more lives will be lost. There will be more lives lost. We know that. So why not call your loved one and tell them that you love them? Because going to the funeral to speak over someone at the funeral is not, they don't hear that. They don't see they can't smell the flowers. But what you can do is call and tell them that you love them. Give them a kind word today. Again, we have 18 residents of Dougherty County, and we have 10 waiting to test results, a total of 28. Thank you.
What I'd like to do is open up now for a few questions. And one question that we'll start with that came in, we'd like to have Dr. Kitchen to come up and talk about the recovery rates. Is one question that we've had. Dr. Kitchen.
Yeah, and I'll try to speak to this kind of with the information I have at hand, which is incomplete because we know we have people who have tested positive in private physician offices who may be recovering at home, and so we don't necessarily have that in our internal data here, but what I can tell you here is we've had a total of 357 positive tests across the health system, and of those, 207 are not in our facility, and that does not include deaths. So I think that gives you some idea out of the total number of positive tests, how many people are no longer in the hospital and are at home. So, you know, what I think based on our understanding of the clinical course of this illness at this point, fortunately, most people who become ill have those typical respiratory symptoms that we talked about: cough, fever, some degree of shortness of breath, but their symptoms are not at the point where they actually require hospitalization. And we have seen that with employees. You know, we certainly have had employees who have tested positive, and the question comes up, when is it safe for them to return to work? And fortunately, the CDC provides a lot of guidance there. And so what I can tell you is typically that course of illness is about 1 to 2 weeks. And so that for individuals who are positive for COVID-19 but don't require admission to the hospital, I would say that time of recovery is usually about 1 to 2 weeks. And certainly we're seeing that with our workforce as well, where they're cleared to come back to work usually within 7 to 14 days from the time they first began developing symptoms. So that's one group. You know, the group that requires hospitalization, I think based on the limited information that we have, their recovery period is going to be longer. And so for their symptoms to really go away, particularly the shortness of breath, usually their period of convalescence is going to be longer than that. And again, you know, this is all information that's still evolving at this point, but that may be a 2 to 4 week convalescence. The group that you know, really concerns us is that group of individuals who develop significant shortness of breath and what we call respiratory distress, to where they're requiring high dose oxygen. And we have noticed that some of those patients can become unstable from a respiratory standpoint in a relatively short period of time, very uncharacteristic for what we see in the general population. And so their oxygen requirements can go up dramatically. Their oxygen concentration can drop precipitously, and those are the patients who require admission into the intensive care into the intensive care unit. The group that I think the present statistics are really rather sobering are the group of patients requiring admission to the intensive care unit who develop what we call respiratory failure and have to be put on a ventilator, and they require what we call mechanical ventilation, because in the limited experience that we have, despite all the therapies at hand, it can be very difficult to reverse that course. And so there is kind of a progression that we see with that group of patients where they, you know, have to go on a ventilator, and then sometimes even despite very high doses of oxygen being provided, that they're not able to maintain adequate oxygen levels for their vital organs to remain healthy, you know, and that's things like the heart, the kidneys, and some of the other vital organs. It can be difficult even despite being on a ventilator and being on a high dose of oxygen. And so some of those patients, unfortunately, progress to what we call multi-organ system failure. And in that group of patients, the mortality rate, unfortunately, seems to be exceedingly high. And again, based on limited medical studies at this point, but the mortality rate seems to be well above 50% in that group. So I think that's why there currently is so much focus on, are there available therapies out there that can really alter the clinical course of that illness?
Ms. Howell, if you will make your way to one of the microphones for your question, please.
Okay, have two questions from the Atlanta Journal-Constitution, one for Dr. Kitchens, one for Dr. Ruiz.
Okay, Dr. Kitchen, will you please come back and then followed by Dr. Ruiz?
Dr. Kitchens, do we know the total test pending, the total number of tests pending?
Yes, we do, and I'm sorry I did not share that today. So, total number of tests performed, 2,480. 357 positive tests, 533 negative tests, 1,590 tests that are pending.
Thank you. So, Dr. Ruiz, the question for you is, what are the deaths in the counties outside of Doherty within this region?
We have one death in Baker, one in Early, 5 in Lee, 1 in Mitchell, 2 in Terrell, 1 in Worth, and I believe that comes to 11.
Thank you. I believe that's all.
Thank you very much, all of you, for being here today, and those who are watching, thank you for joining us. We will not have a press conference tomorrow. We will reconvene on Monday at 1 p.m. To begin the week of press conferences. So we will not meet tomorrow, and we'll be back on Monday at 1 p.m. Thank you, and have a great day. Be safe.